Without further ado, I am delighted to introduce the second speaker, Professor Albert Kilicaslan, Professor of Anesthesiology, Nismatin Arbakan University, Miram School of Medicine, from Konya, Turkey, and he's expert on ultrasound-guided nerve blocks and vascular access. He will talk about POCUS, vascular access and regional blocks for thoracic surgery. Again, just a reminder, please be sure to type your questions into the question box to ask the faculty, and we will gather all questions and we'll try to address most of them online at the end of the 6 talks. Albert.
Thank you, Dr. Tahan and Dr. Mert Senturk, for kind invitation and nice introduction. I am delighted to be here this evening. Hello, everyone. I am from Konya, which is a mystical and historical city in Turkey. I have nothing to disclose. There is no endpoint where you can use ultrasound, and nearly all organ systems can be evaluated using POCUS. Now I am going to talk about the use of ultrasound for vascular access and regional anesthesia for thoracic surgery, 2 topics in the next 20 minutes. Although central venous catheter in shortly CVC placement is a routine procedure in anesthesiology, several complications may occur, up to 19%. This article clearly showed that the jugular vein is not always located lateral to the carotid artery. You can see in this diagram, it can be located almost anywhere. Anterior locations increases the risk of artery puncture, and this is one of the reasons that why we need ultrasound guidance. 20 years ago, in 2002, the use of ultrasound had been examined by the NICE team from United Kingdom, and I found that compared with the landmark method, ultrasound guidance improves the success rates and reduces the complications. So it basically makes your procedure safer and faster. During the last years, many international guidelines have suggested the ultrasound as a primary technique for vascular access. And the latest one is EACTAIC Thoracic guideline issued in 2020, and I will try to summarize the recommendations. Ultrasound guidance strongly recommend for access to all central veins. The guidelines suggest a stepwise approach that I will show you in a few minutes, and they also suggest that it is useful for detection of variations, disease, and complications. They reported that in terms of safety and efficacy, the use of an out-of-plane approach is similar to the in-plane approach when it is used for internal jugular vein cannulation. There is still lack of agreement on the use of an infra or supraclavicular approach for subclavian vein cannulation. And the guidelines recommend an out-of-plane puncture of the femoral vein using a short axis view, a panoramic view to avoid complications. The use of ultrasound guidance, real-time ultrasound guidance, recommended for artery line placement in all hypotensive and unstable patients, in those with vascular disease and a weak pulse. There is no difference between out-of-plane and in-plane technique for radial arterial line placement. And the guidelines suggest a modified Allen's test using duplex ultrasonography and color Doppler to evaluate ulnar artery collateral blood flow. You can determine the location of the artery, the size of the lumen, the course of the artery, so you know exactly how it runs, which helps you cannulate it, and finally, you can confirm the location of the needle and the catheter inside the lumen of the artery. Ultrasound enables the use of new puncture size